So anesthesia for extraction of the upper right 7. I'm using extra short needle, articane, directing the needle toward the apex of the tooth, sharp scratch, about 45 degrees to the tooth, and injecting for the posterior superior alveolar nerve. And then my second injection will be on the palatal side of the tooth to be extracted, open wide. Here I go at right angle, sharp scratch. This is for the greater palatine nerve. This tooth has got an abscess, and the patient is not keen to save the tooth by root canal treatment. Okay, so the plan is to extract this upper right 6. However, this tooth has got a veneer that's very close to the 6. So to reduce the chance of knocking off the veneer and cause damage to the tooth, this is what you do. So you remove, open wide, the mesial side of the tooth to be extracted using fast speed and beat. You're not touching the adjacent tooth, you're just removing So doing this, you are less likely to damage the adjacent tooth. So once we did that, I start with my luxator. I go buccally to the tooth to be extracted, gently expand the socket and have a feel of the tooth. Is it behaving or is it not behaving? I do the same on the palatal side. Very carefully, very gently. Go back buccally. Then I grab my correct forceps, beak to cheek. And remember, identify the correct tooth. Push, push, push. Push really hard. Well done. Support the alveolus. Very gently. Figure of 8. Slowly, nice and slowly. Not touching the adjacent tooth. So you can, doing fantastic. Keep pushing apically, slow steady movement, and then the tooth is out. So testobuccal, mesiobuccal and palatal root intact. That's how you do it. Ta-da.